That are concerned about this, as you know, and one of the concerns that the doctors have is that the clinical trial process has not been the same that it would be for any other pharmaceutical medicine, and therefore they don't have the scientific proof that this drug is doing what it's meant to do, other than analogous, other than people like yourself who say, yes, indeed, it does make a difference.
Right. Bev, actually, again, there's so much information all over the internet, including at the International Association for Cannabinoid Medicines. The doctors and scientists at that particular forum do studies on a regular basis using cannabis as medicine all around the world. So literally, that's been my biggest savior for the number of years that I've used cannabis. I actually was introduced to a doctor named Dr. Ethan Russo from the U.S., who actually is a neurologist and specializes in multiple sclerosis and the violent pain I have in my face called tic douloureux and medical marijuana. And Dr. Russo I brought up to meet with Alan Rock here, our Minister of Health, our Liberal Minister of Health in the mid-1990s, to teach Canada about cannabis as medicine. And Bev, sadly enough, they're just not listening.
Well, Alison, let me ask you about the amount, because now it's going to allow you to have 150 grams per month at approximately $5 a gram. Is that about what you're using now?
Actually, that's wrong, Bev. It's 150 grams every time we leave the house. That's what we're allowed to carry on
have
us.
On your person, yes.
Yes, it's 150 grams, which is approximately 5 ounces or 5 bags of marijuana, 5 lunch bags of marijuana. So that particular amount doesn't work for some of the larger licensed people in the country. We are licensed everywhere from 3 grams to 200 grams a day, people all across Canada. And I know that mine is one of the larger prescriptions, and 5 ounces would not last me if I went away for a week. So that's the sort of thing that we're fighting, Bev.
All right, and I know we'll probably talk to you again, Alison. In the meantime, thank you for coming on the show.
Can I just show this picture? This is me using, this is 18 years worth of medication for me. And this is 5 days after I got out of the hospital without marijuana. So I want people to know that there is a big difference for people like me that suffer from chronic progressive multiple sclerosis, and that there is help with things like medical cannabis.
Okay. All right, Alison, thank you.
Thank you so much, Bev.